My name is Dr. Ash Soni and welcome to my mini-series with AlumierMD. In this skin series, we are going to be discussing all things the aging eye, how to improve that area and just improve that skin quality. And why would you want to take advice from me? Well, I am a plastic and reconstructive surgeon. I've trained in both the UK and US and have done up to 10,000 surgeries on the face and body. I've gratefully been featured in publications such as Vogue, Forbes, Harper's Bazar, TATLER, Elle, just to name a few. And I'm here to share all of my experience over the last 15 years with you all. In this first video today, we're going to be discussing all things retinol around the eye, and we're going to bust some myths, the myths that go on in social media, what's true and what's not. Retinol is absolutely safe in the under eye area. You have to be guided appropriately. Now, when patients use high percentage retinols, it can irritate the skin. So you want to be guided in a way that's low and slow. You want to start slowly with a lower dose of retinol so that your skin can tolerate it better. And that minimizes the chance of any irritation or any issues under that area. And we know in the medical community, with decades of research on retinol and vitamin A derivatives, that it can boost collagen, increase cell turnover, and improve that skin quality and health that we all need as a result of aging and environmental damage. The evidence that we have on retinol is published in many peer-reviewed publications globally, and anyone can access that via the internet, if you fancy a little bedtime reading. My patients are always worried that if they use retinol under the eye, it will make them look a little bit more wrinkled. Now, the only reason that they may notice a little crinkling effect of the under eye area is if they use too much retinol. Now, retinol will exfoliate the skin. And if you use too much or too high a percentage, it can over-exfoliate. And that over-exfoliation can lead to a temporary crinkling of that skin, leading to what may look like the appearance of wrinkles, but it's short-lived. And you just need to take that as a sign to go low and go slow. Once you get past that initial little crinkling, if you do get that over-exfoliation, to pursue retinol in general will give you a much better long-term effect on the skin, and retinol in fact will boost the skin, it will plump it, and it will improve that quality of skin. So the whole purpose is to actually benefit the wrinkles. From my medical experience and being in the world of skincare for such a long time, I have never seen anyone develop a true allergy to retinol. No one can say it can never exist, but I have not personally heard of it professionally. The main thing with retinol is that you are guided appropriately in terms of how often you're using it and how much you're using it. If you do develop signs of a reaction, take a step back and go and speak to your provider about it. When patients do experience similar symptoms to a reaction, it often means that it's the over-exfoliating effects of the retinol itself. So you just want to dial it back and it will settle out. To avoid or minimize the side effects associated with retinol, firstly, speak to an experienced provider and really have a personalized approach so that you are guided and you know how to start this. Often for patients with sensitive skin, I personally will start patients using it maybe once or twice a week just to get used to it, and then you can build it up. You also want to make sure that the concentration of retinol is lower, because if you use too high a concentration, especially where the skin is really thin under the eye, it may lead to irritation. For the under eye area, in order to minimize the irritation or side effects of a retinol, you want to be able to layer it. So sometimes you'd layer with either a serum or an eye cream, such as AlumierMD by AlumierMD. It's also imperative to use an SPF because when you use a retinol, it can increase your skin sensitivity to sunlight. So really be good about that SPF use. That is a rule that you should apply always and forever. And if your retinol reaction surprises you, it means that you need to pay a little bit more attention. Look in that mirror, check that there are no signs of irritation, and with any concerns or questions, you should always go to your experienced provider. Retinol can really be used from early 20s onwards, and the reason I say 20s is because we all know that from the age of 20, your collagen falls by 1% a year. Now, with that collagen falling, it's really important to use a retinol to be able to boost that collagen and improve that skin quality to help with the aging face. So really, I would say from a preventative standpoint, 20s is more than appropriate. It is also never too late to start using a retinol eye gel. You really want to, at any time point, whether you're early or later, it doesn't matter. The main thing is that we get you on the right skincare plan. And we've already emphasized the benefits of retinol itself. So a retinol eye gel can really be used at any time point. Since I discovered retinol eye gel by AlumierMD a couple of years ago, it far became my favorite just because of the pure quality and innovation and thoughtfulness behind this amazing product. I love this formula for 3 reasons. Number 1, it's a low 0.1% retinol, which means that it's much better tolerated. Number 2, it's encapsulated. The encapsulation is almost like a bubble wrap. It's a protective layer around that retinol. So when it gets released into the skin, it's a slow and delayed release, which means that it minimizes side effects. I did a clinical study recently and patients really tolerated it and were super comfortable from day 1. And number 3, there are other ingredients that have been added to this, like bisabolol, which is a chamomile extract, and it just helps to soothe it. It's got niacinamide to protect the skin barrier, and allantoin, which is a plant extract which helps retain water and protect the barrier too. When applying retinol eye gel in your routine, it's really important to use it only at nighttime. It's also really important to add that SPF in the morning. And if you're layering it, make sure you put it underneath your Illumini. So put it on first and then put the Illumini on second. And if you need a little bit more guidance, speak to your provider because they can guide you so that you start maybe with 1 to 3 times a week at nighttime and then gradually build up. So it's basically an acclimatization process for your body to get used to it. My other top tips that I would share with patients at the time of a consultation would be, number 1, it's really important to get your lifestyle factors in place. Get that sleep, hydrate yourself, improve your skin in ways not just from the physical perspective, but also the mental perspective, because we know that lifestyle plays a huge factor in how our skin appears and looks. Also, be consistent. Form those habits. You want to use that skincare consistently. And if you need professional advice, please come and see one of us to chat to at the time of a consultation. A lot of patients get really nervous about overusing it. And you want to make sure, you don't want to be blasé. You want to make sure that you're using it appropriately, but also don't be super nervous to use retinol because retinol is so good and can be used so well and so effectively if in the right way. So just speak to professionals if you need guidance and advice in terms of how to do this in a safe but yet sustainable manner. Honestly, if you want to treat the aging under eye area most effectively and optimally, retinol is going to become your new best friend.